Patrick's going to be talking about improving immunisation coverage with keeping the body in mind, vaccines, a co-designed vaccination service for mental health consumers. So please join me in welcoming Patrick.
So good, yeah. Thanks. Thanks so much. Thank you so much. So I'm Patrick. I'm a mental health nurse working in South Eastern Sydney Local Health District as part of the Mind Gardens Neuroscience Network, and now as part of the Keeping the Body in Mind vaccines program. Janine was meant to be here, who runs the clinic with me, but unfortunately she wasn't able to make it, so I'll be presenting on her behalf as well. So this is really an overview of a story starting from the beginning of COVID through to now of setting up quite a large-scale vaccination program that's ended up being co-designed. It's from the beginning of realizing that vaccines were quite inaccessible for our clients and then working with them to develop solutions that work for them. So just in case everyone's pretty aware of vaccines now, but when we're talking about vaccine-preventable diseases, we're talking about any condition that can be prevented by vaccination, which is this big list here. And the ones that we're covering in the clinic that we're giving are there in red. So there's quite a lot of vaccines to give, which makes it quite difficult. They've all got their own different criteria. They've all got their own cost and different things associated with them. So navigating what vaccines you should have, especially if you haven't had catch up your childhood vaccines or aren't aware if you've had them, can be really difficult, as I'm sure any of you know who's had to go through that process within a health service to get all your vaccines caught up. So mid-2021, Equally Well put out the global consensus statement for fair and equitable access to vaccination for people living with mental illness and substance use disorders. And that was about the same time that I'd started running this clinic. So it's really good timing for me to have something to justify what I was doing. And this really highlighted that even at that early stage, there was really clear evidence of inequitable health outcomes and vaccination for this group. These are the results from New South Wales, which my colleague Grant Sara just presented 20 minutes ago in another room, which I was at. And so we looked at vaccine-preventable hospitalizations in mental health service users compared to the general public and found overall it was 3.2 times higher amongst that group. And now that's any mental health service user, not particularly severe mental illness or lots of contact. That's anyone who's accessed any mental health service during the time period. And we saw that it was, if you look on the left, that's the rest of New South Wales, and on the right is mental health service users. You can see that the risks are extremely elevated across all age groups, particularly elevated across men and also across females, but men particularly at a younger age than what is normally seen in the general public. And people are also hospitalized at a much younger age for all conditions as well. So they're younger and they're sicker when they're in hospital, stay longer in hospital, and are more likely to be hospitalized multiple times. So that's sort of background about why this is quite important. So to begin with, this is a question that I always get asked when I talk about this. So I thought it's good to kind of cover it off the bat, is why this shouldn't be done in primary health and why we're doing it from the mental health service perspective. And there's a lot of barriers to accessing primary health generally for people with mental health, people who access mental health services. And there's very little to no incentive for GPs to cover this. It's quite a complex thing to do a full vaccine history. And so with everything else going on, with all the other comorbidities, bringing up vaccines is at the bottom of the list. And most of the vaccines that we've seen given were not given by GPs. The National Immunisation Program itself doesn't cover people with mental illness as a special risk or high risk group, despite there's quite a lot of evidence that they should be treated in that way, or that that's looking to change. But what this means is that there's no fee exemption for any of the catch-ups or flu or anything like that. So I had someone I was speaking to the other day who was getting their HPV vaccine catch-up, and it was going to cost $250 per vaccine for 3 courses. They couldn't give it out of the ones in their fridge, and so they had to go to the chemist, pay for it at the chemist. They had 15 minutes to not break the cold chain of the vaccine, to take it back to the doctors, to have it given, and no bulk billing for the whole thing. So there's a lot of difficulties in accessing it with primary care at the moment. In terms of COVID-19 at the beginning, people with severe mental illness were considered within a high-risk group, the same as healthcare workers, other than the healthcare workers in the emergency department. However, what we saw, at least with people I was working with, is they weren't being prioritized at all for vaccination. By the time we had all of our healthcare workers vaccinated, we had 1.5% of our mental health consumers vaccinated, even in the inpatient units. So it just wasn't being done despite the same risk categories. So we decided to do something about it. Me and one of the peer workers, Cheryl, and a few other clinicians in our own time at work essentially decided we should start our own vaccine clinic to cover this. So we went out, did the training, became accredited immunizers, and then began the long process of getting access to vaccines. We found when speaking to consumers that the drop-in clinics were actually turning them away. We found some drop-in clinics would accept people, then started getting buses and taking people to them, and then we were told, please stop, there's too many people. And the mass vaccination hubs were difficult for anyone to access, and they were quite far away, and there's a 3-month wait by that point. So we set up 2 drop-in clinics within community mental health centres in the eastern suburbs. So we partnered with the Kirkton Road Centre, who were already providing vaccinations to at-risk groups. They supplied us the vaccines, trained us in the model, and helped us run it, which was incredible. And that's a photo of us there during one of the clinic days running it with the team who were supporting the whole clinic. And this was all done kind of in kind, in addition to people's jobs. No one was released to do this. So it was really quite an effort. And Cheryl, who's there, was one of the peer workers who was really leading it, helping guide people through, having those conversations about vaccinations, and making sure it was run in a really nice, smooth way. So from that clinic, when we were running it, as you can see, these are the rates for mental health clients in the community mental health service. And when phase 1B commenced over there, that was when people were supposed to be prioritized for vaccination. And the rates for healthcare workers went, within 3 months, went pretty much up to 90-something%. So it was really quick, and we should have seen that in this group too. Then phase 2A commenced, and that was opening up to a lot of the general public. That made it even harder for mental health service users to access vaccines because there was suddenly massive demand, as most of you will remember. And so then we finally got access to the vaccines and got the clinic set up. And when we set up the clinic, we saw a huge uptake of, we administered around 600 vaccines, getting it up to around 82%, which at the time was only 6% lower than the general public, with other mental health services, when we looked at their data, was sitting around 30 to 40%. So we got it up really quick. And then when the boosters came out, we ran another kind of blitz clinics and got everyone done again and got it up to exactly the same as the general public, which meant that there was actually a higher proportion of people who were willing to be vaccinated generally had the booster. So amongst people who were vaccinated for double dose, those who had the booster was actually much higher than the general public. So a lot of people thinking that this is due to kind of symptoms of mental illness or paranoia or all those sort of things, we haven't really seen that. It's mostly around access and people coming to them and working with them. So after doing that, we essentially got some funding to create this as the Keeping the Body in Mind vaccines program, to get some more permanent funding to get this running, not permanent, but for a 1.5 years, to get this running properly. And to do that, we thought we should co-design it to make sure it was running in a way that would work for the consumers and involve them within it. So we ran a workshop with service users from all the way from early psychosis in age groups up to older person's mental health, and brought clinicians in there too from different services to make sure that we'd have their views on it as well, so that it'd be running in a way that works for everyone. And we've continued to keep these people involved throughout the process. They've attended the clinic, they've provided feedback on it since then as well, so to keep them involved as decision makers. The key findings were that with co-design, from the co-design, it was grouped into 4 different categories. One was promotion of vaccines, where we found that they wanted it to be opportunistic, so it's when people are ready, when they're already in the mental health service, be able to give it pretty much at any time that someone decides to do that. Also to have co-produced pamphlets on myth-busting vaccine hesitancy, which we're working on making, but they're taking a bit of time to get that out there. It's a complex topic to write about as well. In terms of attending the clinic, this is the main thing that's really helped, other than having a peer worker that came up from that, which we hadn't thought of, was being able to bring a family, friends, key workers, or anyone who's with them to also be vaccinated, also for free. And so that works really well in terms of mental health clinicians would bring consumers along with them, they go together, and they go together to get vaccinated at the same clinic. So it wasn't just, you've got a mental illness, you're at risk, you need to be vaccinated. It was, let's go together to the clinic to have this happen. It was free for all consumers, and it still is, which we're very lucky to be able to have done, and to have home visits available for people who aren't able to make it to the clinic, which has been a bit tricky to get out there with all the oxygen tanks and adrenaline kits and everything, and it looks a bit intimidating coming up the stairs with that, but we've managed to do it for the people who need it. In terms of receiving the vaccines, have phone calls to people who want it. One of the things that's been really good, particularly at the community mental health centers, is to give the vaccines in the sensory room where people can sit there, take their time, they can wait in there if they need, with the massage chair. It's a much more pleasant way to receive the vaccines. And to give a color laminated certificate that they could be proud of receiving the vaccines, which actually was a really big thing for many people. And people got really excited when we brought that out to them after receiving the vaccines, much more than I thought people would from getting that certificate. And for follow-up after the clinic, making sure we have assertive follow-up with future vaccine dates, particularly for vaccines that require several courses of a half a year or that sort of thing, to make sure we're really assertive in helping people to come to the clinic, be aware of their appointments, providing a book with their appointment dates, and following up with phone calls, emails, texts, whatever works for them. So that co-design is now being rolled into the Keeping the Body and Mind Vaccine Service, which is rolling out that model with a clinical nurse specialist and a peer worker working side by side to run this clinic. Taking a full vaccine risk history, offering all vaccines as per the National Immunisation Program for free in a way that works for mental health service users that they're comfortable with, taking the time to listen to them, to provide that education, and to work with them. And so it's been funded by the Central Eastern Sydney Primary Health Network through the Mind Gardens Neuroscience Network to run this within the South Eastern Sydney Local Health District, and looking to expand to drug and alcohol services as well to offer it to a broader group within this area. Now, it only started 2 months ago. We've managed to give 100 vaccines since its starting, which is pretty good considering it hadn't been running for a while and there's a lot of setup to get done, which is primarily at the moment COVID-19 and flu vaccines, which we've given. And you can see most of the vaccines we've been giving are boosters beyond the primary dose. We have given a few to people who were unvaccinated entirely for COVID, and this was not by choice. Most of them, when we offered it to them, people who are fully unvaccinated were actually really wanting to receive it and had been struggling to navigate the system, struggling to book in for appointments and to get that sorted. And flu vaccine uptake was primarily in those under 65. We found that actually a lot of our clients 65 and over were already vaccinated for the flu vaccine, which is a real testament to the older person's mental health services in the area for coordinating that. So that's the next steps, hoping to expand to other local health districts and test the scalability of this model in other areas. Thank you. Any questions?
Cool. Thank you for that. Very interesting presentation. Any questions?
Terrific idea, and thanks for the detail. I was just wondering, do you see sometime down the track and with appropriate work on it, it being applicable to more community centre kind, say safe havens or safe spaces?
Absolutely. I think that's the model that would be really good to work on for more long-term looking at this. At the moment, there's essentially a huge vaccine gap in most vaccines for all people, which requires a really big targeted effort to do a lot of vaccines and get that done. Once that's done, it's really just maintaining those vaccines with the yearly flu and COVID and things, which I think would be a lot better to roll out in centres like that, where it's kind of less just having it everywhere, but more routinely when people want it and having it like that. But the only model I've found of anyone else doing this was actually run, I can't remember what it was called, but in America, which was run by people with lived experience entirely in a centre like that in America, which had really good success rates. Any other questions?
That's for the people online. So, we're in no rush.
I was really interested that you said that it was about access rather than vaccine hesitancy. And were there instances where you did encounter that? And if you did, what were the strategies that were used around, I guess, education or?
Yeah, absolutely. So that, I mean, I've worked in some clinics that are for the general public too, and there's, the approach is actually really similar in terms of people who are like that, which was really you've got to make sure you've got the time to have those conversations with them and not push the vaccine then and there. A lot of people we've vaccinated, after the third time I've spoken to them or the fourth time and that sort of thing. But really, I mean, it's around getting past that stigma of someone being vaccine hesitant and seeing them as, they've got the wrong idea and I've got the right idea and I need to teach them that it's good to have vaccines. It's more about understanding why they're feeling that way and what they're really worried about. And talking to them about what's important for them has been really the main thing. And a lot of people have people who are at risk who are at home with them or people who they want to see. And so when they kind of talk about it like that and they, especially with AstraZeneca, there was all those concerns about, this could kill me, this vaccine and this sort of thing. You talk about the risk of that, and you talk about, you know, their mother who's 85, who's at home, who they look after, what the risk is for her if she gets it, and if it's brought home by you, that makes a big difference. But it has to be from a perspective of, like, I genuinely want to learn why they don't want it, rather than I'm here to teach you why vaccines are good. So, but it took a lot of work to get to that point, yeah.
I don't know how much overlap there is with people who were in this last session about human rights in this same room, but it just strikes me that this is a really good example of that applied right to health, voluntary, where the person needs it, where the person wants it, really kind of adjusted service delivery to the people, you know, to meet their needs. I just think that's a nice follow-on from that session. Any further questions? Okay, thank you so much. I really enjoyed that presentation.